Welcome to Upper Cervical Chiropractic Clinical Case Review, where I go over a case of a patient that I managed and how upper cervical care had a crazy significant impact on her life. My name is Dr. Chris Brown. I have been an upper cervical practicing chiropractor for the past couple of years, and now am looking to get my own practice going out in Lafayette, California. This chiropractic case in particular, this is a 20 years of migraine upper cervical case where we were able to get resolution of her migraines, and this patient in particular went from being hospitalized from going on a walk just down the block and back towards now being able to do CrossFit 5 times a week. During the course of care, let me restart this. Okay. Welcome to Upper Cervical Case Clinical Review, where your host, Dr. Chris Brown, goes over a case that I saw in practice, the history of it, how I managed it, how care went, and the life changes that this person experienced. Today's episode is going to be focusing on a person who had been dealing with migraines for about 20 years. And she saw drastic changes during care. The most notable one was her capacity to handle stress, in particular physical stress. She had the desire to be a very active person. She would go on walks or try to go on hikes, and more than often would end up hospitalized due to severe, intense migraines. And by the end of care and continuing on now, she's able to do CrossFit 5 times a week and pushing herself to the limits. She's going up and down Pinnacle Mountain 3 times a day when she's going about it, and it's really awesome to see. So I just wanted to kind of share her history, how she presented, her review of systems, the connection between migraines and upper cervical, how we went about managing her case, what we found on the exam, and how care went, and how life is for her now. So this woman, she came to me about a couple years ago, and she'd been dealing with migraines for about 20 years. She had gotten hit by a ceiling fan when she was a kid. We found that out during her exam. And she has been essentially having debilitating headaches and migraines since. The way that she described it, it was like she called one category like thunder and the other lightning, where the thunder would just be this like constant low to mid grade, just like pain in her head, where the lightning would be like the zingers. And she described them as going all over her head. It wasn't one-sided, or it wasn't just forward or back. It was all over her head with pretty serious neck pain. She had arm numbness as well, lower back issues, rib issues in terms of musculoskeletal. But when talking about her headaches and her migraines, she had tried a ton of stuff. She had gotten brain MRI, she had gotten CT scans, she had gotten blood work done, she had gotten the EEGs, and everything came back normal. Everything had said, you are perfectly fine. We don't know what's going on with you. She had been prescribed propranolol for her migraine. She also had been prescribed duloxetine for her anxiety. And none of that stuff was helping her. And she had been dealing with this for 15, 17 years. And so she was at church one day and just being prayed over because her migraines were so bad. And someone said, you need to go, you need to make a call to the specific chiropractic centers. And she made a call saying, hey, I was told I need to come here. I got super bad migraines. And she came to us, and we were able to identify whether or not that she'd be a candidate for care, whether or not we'd be confident in managing her case. And when it comes to migraines, typically when we hear about migraines are much more of a functional neurologic issue versus a structural neurologic issue. When we do all of these tests, whether it's a EKG, EEGs, brain MRIs, CT scans, blood work, all those doctors are ruling out something structural, such as a tumor or some kind of pathology that would indicate the cause of headaches, but they're not doing a functional test. And so that's what's super imperative when it comes to diagnosing the root issue of what's starting these headaches in the first place, is we need to actually be able to test and assess the function of one's nervous system, which is where computerized infrared thermography, aka Titron, is super critical piece, not only to determining and managing chronic migraines, but also what we do here in upper cervical chiropractic, specifically at at our clinic here, the specific chiropractic center. So that we have that at our clinic. So we're able to do that for this patient. We're able to run a scan. It looks like a Walmart scanner, but it goes up the back of her neck. And we were able to actually assess in real time, is her nervous system in a state of proper function or in a state of abnormal function? And that's where we're able to determine whether or not we're confident we can help this person. So I ran a scan of her neck, and of her spine, of her nervous system, and saw that it was in a state of dysfunction. It was in a state of a lot of stress. And that indicated to me, okay, hey, this leads me to know that there is a misalignment of the upper bone of the neck. That is what we take care of here. This scan reveals that that is present. I do not know yet what that misalignment is, but we have the examination process to be able to identify what that is unique to you. And what that is unique to each person are these two bones of the neck right here. So this one is the top bone of the neck. It's called our atlas or C1. This bone of the neck is called our axis or C2, and they sit on like this right at the base of the skull. This is the top of our spine. These are the first and second vertebra of the spine. What is housed in these two structures is called our brainstem. And our brainstem contains every single nerve that goes from our body to our brain, and then also from our brain to our body. So it is hyper critical. It houses like 7 trillion nerves. It's phenomenal. And so these two bones are very critical for the function and the communication of those nerves. Upper cervical itself is based off of 4 tenets. Number 1, the body can heal itself. Healing codes come throughout our body. They are generated by our brain. That's point number 2. Healing codes come from our brain, communicated via nerves, via the electrical signals. That's how we're able to be an animated body, is because we have electricity making us active and move. Otherwise, we'd just be a dead corpse. And number 3 out of 4 is that this brain-body communication site is of the utmost importance. If there's anything kinking that flow, or like kinking the hose, causing these healing codes to just drip out into our body versus being an open hose, then it will make sense that chronic health issues will start presenting and appearing over time because our body is starving of those healing codes. So we want to make sure that these two bones are functioning properly. Much more, we want to make sure that the nervous system is functioning properly. When the nervous system is not functioning properly, we know that it's because these two bones are misaligned in a stuck state. We're able to verify and confirm what that is unique to this person based off of motion x-rays that we do in our x-ray suite, where we actually induce motion while shooting the x-rays to elicit to see how the bones are moving. Because when the nervous system is in a state of dysfunction, that is a biomechanical issue, that is a functional movement issue. So when we take x-rays, we have to be able to assess the motion, aka the movement of those bones. Now it's a lot more complicated than it seems. With these two bones, there are 276 different combinations that these two bones can misalign. And we are trying to figure out the one to unlock everything for this person and allow her body's healing capacity to reach its maximum output and have optimum communication between brain and body. So for this patient in particular, back to migraines. Migraines themselves, they have 3 pieces that relate with the upper neck. How could this be connected? There's 3 pieces: blood flow, cerebrospinal fluid flow, and nervous system flow. So with these tiny circles right here, might be able to get a graphic up or something, but these tiny circles on the side, this is where the artery that provides blood to our brain, it passes through as it travels from our heart up to our neck. It's called a vertebral artery. It supplies the base of the brain and about 1/3 of the way around, 2/3 of the way around on either side of the neck. That's where majority of our blood flow to our brain comes from, or the back like 2/3. So if there's any kink, if there's any rotation of these bones like this or any side-to-side movement, that will essentially kink that blood vessel. It'll kink that blood vessel getting to our brain, which will occlude blood from getting to our brain. Blood carries oxygen, and our brain needs a constant supply of oxygen. So if we have occluded blood flow due to a misalignment of the upper neck, that will decrease the amount of oxygen getting to my brain, and my brain cells need a constant supply. So then my brain cells are going to panic, and they're going to start screaming, saying, I need oxygen. That is a headache. A headache is when my brain cells say, I need oxygen. I'm not getting enough because there's a misalignment of these two bones of the neck. So what is it going to do? It's going to ramp up our whole stress response to try to get more blood from my heart up to my brain. So my heart rate is going to go up. My blood pressure is going to go up. All the muscles in my neck are going to get all tight and tense to try to just shunt blood through, which is actually going to be counterproductive because those muscles are going to constrict, further constricting the blood flow. It's essentially almost as if our body's internal fire alarm is going off. That's what these scans are measuring, is our body's internal fire alarm going off, or are the sirens blaring essentially? That's what we're able to test on this scan. Is it there or is it not there? Now, for the second part, cerebrospinal fluid flow, that is the fluid that bathes and nourishes our brain and our spinal cord. It is created in our brain. It has to drain out of our skull and passes through all of our vertebra through this nice big canal here called our spinal canal. So our spinal cord sits in like this, and on the outside of it are little spaces that allow for that fluid to travel through. So if we have any kind of rotation or occlusion of that big canal, such as something like this, which is a very extreme example, or something like this, then that fluid is going to be reduced in effectiveness of getting that fluid to drain out, which is a big problem, especially for headache people, because if you live in an area that has a lot of storms, like Little Rock, Arkansas, then those pressure fronts will create fluctuations in fluid volume in our body, especially in our skull. That's why when people say, oh, I know when a storm is coming when my knee starts hurting, that's a fluid pressure volume thing. Same thing happens with headaches in our skull. So when we start getting headaches that feel very pressurized, that's a big indicator that you have a misalignment of the upper neck, because that cerebrospinal fluid is not able to properly drain out of the skull and be able to relieve that pressure. So that's the second part when it comes to headaches and migraines. The third part is nerve flow, in which case a stressed out nervous system can impair digestion, it can impair gut function, it can impair heart function, it can impair hormone imbalance. And so headaches are a big product of a lot of stress, and when the nervous system is under stress due to a misalignment of these top two bones, it can have quite a big cascading effect. And one of the common outcomes of having a dysfunctional stressed nervous system are headaches, particularly migraines. Now, most people when they come in here, they have what I like to say, multiple symptoms from various organ systems, which we're able to elicit and kind of find out on our history paperwork. So this person in particular, not only did she have migraines and neck pain and arm numbness and lower back issues, but she also had heat-cold intolerance, unexplained fatigue. She also had dizziness, unexplained sensation, ringing in her ear, muscle cramps, palpitations, muscle pain, anxiety, depression, and I think that's it. In which case she'd been dealing with all that stuff for those 15 to 20 years. So as we went through the exam process, we found out that she did have a dysfunctional nervous system based off of our nervous system test, which is called computerized infrared thermography. That is the gold standard of assessing one's nervous system function. So if you're in the area and you're looking for an upper cervical chiropractor, just call them and ask, do you do thermography testing? Just say that. If it's a yes, green light. If it's a no, don't go there. Next, you want to find out if they do x-rays. X-rays are super important because we cannot guess what that misalignment is on these bones. Can't do it. And with our x-rays, we do motion films to actually elicit what is the proper versus improper motion of those two bones, particular to this person. So in this woman's case, her top bone was not moving from left to right, nor from right to left, and her second bone was not moving from left to right. So basically, neither of these two bones were going from left to right, and this top one was also not going from right to left. So essentially, just stuck. When I remember when I told her what we found on an exam and that we know what to do and that we have a resource, she started crying. And she was very grateful that she had found a place that at least said that they knew how to help, because most places that she had gone to just told her it's all in her head, we don't know what to do. And this was the first time where she had been told that, hey, we know what to do, we can help. And it shocked her. She wasn't used to that. And during care itself, for most people, is about 6 months for us. That's just how long it takes for nerves to heal. We're trying not only to heal up that area, but heal up the entire spinal cord. And that takes time. Nerves are not bone, they're not ligaments. It's a timely process, and there is no process that does not take time. So she committed to the process, and we underwent care. I believe I adjusted her around 10 out of 24 visits. 8 out of 24 visits, something like that. The whole purpose of care is to actually adjust you as least as possible. Because if the whole purpose of an adjustment is to restore nervous system function, and we're functioning good, then what would be the point of an adjustment? So what we do every visit is we run that scan, that nervous system test every single visit. We want to verify the nervous system is in a functioning place, and if it is not, then we want to administer an adjustment right at that time. And we aren't looking for reasons to adjust, we're looking for reasons not to adjust. And so during care, I remember initially I started adjusting her on her top bone on the left, and that was doing good, but it was kind of in and out. She started having days where she didn't have headaches, which was a big win for us because she had been constant for 20 years, which I cannot even fathom. And then I actually switched to her second bone of the neck on the left based off of the x-rays that we shot. And I was like, I think this might result in you having longer lasting holds. So the whole goal here is to adjust you as infrequently as possible to have the longest gap between adjustments. That's actually when the music occurs in the notes. So she started having weeks where she wouldn't get a headache. She started being able to go, hey, I haven't gotten a headache in 10 days, haven't got one in 14 days. And then we started getting months where she would be telling me, reporting to me that, hey, I've only had 2 headaches this month. Not even the thunder. You know, the lightning hasn't been there, but also not the thunder. And then one day she came in, she goes, hey, guess what? I walked, she was a nanny. So she's like, I walked the kid 7 miles today. No issues. I was like, what? And then she started going to CrossFit, and then she started going to hiking the nearby mountain like 3 times a day. And I was like, you are a completely different person. And I don't take the credit for that. It's her body that did the work. The really cool part for me, not only was that, but that all of her other symptoms cleared up too. And all the dizziness, the heat cold intolerance, the fatigue, the unexplained weakness, her anxiety and depression got better. She got off of her meds, and she started to be able to live the life that she wanted. And it was just her body that just needed to get that interference removed, her body to do the work, and her body to do what it is designed to do, which is to heal. And all we do here is just check and verify whether it is in that healing state or not. So it was a pretty awesome journey, one that I will look back upon for the remainder of my career. She was actually my very first patient in practice. So this is a special story for me to share. And if you're continuing to watch and look at these, there's going to be a lot more coming out. But I appreciate you for just tuning in, checking this out. Please subscribe to my YouTube. Please subscribe to my Substack. That's a lot of more of the written stuff of what I'm saying. Check out my Instagram, drchrisbrown_DC. Check out my Facebook, drchrisbrown_DC. All that is the same, Dr. Chris Brown. @chrisbrown_DC. Just please subscribe to it. And that would help me out a lot. Tell a friend about this, because I'm sure you probably know someone. The odds are that you know someone that's got migraines and headaches or chronic health conditions that need help. So have them reach out. If you're not local, I can potentially guide you toward a place that is. And I'm just here to help, and here to help humans express life to the fullest and be the pilots of their own life.